Hello, this is Just Listen, hosted by George Goodman. Today is May 4th, 2026. Welcome to the podcast and my normal spill of please check off and subscribe and then follow me. Okay, today I want to talk about the U.S. federal government policy on the 2025 changes to Medicare and Medicaid and the Inflation Reduction Act. Now, I added the Inflation Reduction Act because in the big, beautiful bill, that was part of the changes too, as far as billing and etc. are based on inflation. That's why I added it. The first thing I want to talk about is the frequent false claims that the mainstream media puts out about the changes to Medicare and Medicaid. Okay, here we go. Claims regarding undocumented immigrant coverage false claim. Illegal immigrants are being removed from Medicaid to save taxpayer money. That's not true. Undocumented immigrants have never been eligible for full Medicaid or Medicare coverage. The 1.4 million individuals often cited in these removals are actually lawfully present immigrants. Example, refugees, asylum people, victims of trafficking who are losing eligibility because the list narrowed to qualifying legal statuses, which only include green card holders, CAFA migrants, and Cuban and Haitian entrants. So that is the scope of who they're talking about that they are removing from Medicare and Medicaid. It's not everyone that's an illegal immigrant in the country from the perspective of there are legal immigrants in the country, but the scare is that it's all immigrants into the country. That's the false claim. Misconception about waste, fraud, and abuse. Most of the bill's nearly $1 trillion in Medicaid cuts come from eliminating waste, fraud, and abuse. The reality. A nonpartisan analysis by the Congressional Budget Office, you've heard of them, and other researchers indicate that actual anti-fraud provisions account for only about 3.2% of the total cuts. Because the U.S. federal government policy people, the Trump administration was talking about they wanted to get rid of the fraud, waste, and abuse. And when they actually did that, it was only 3.2% of the total cuts. So the vast majority of savings, nearly 50%, resulted from terminating coverage from millions of people due to new work reporting requirements and semi-annual eligibility checks. That's why people got taken out of Medicare and Medicaid. So the narrative is that the lazy adult are the reason why people are just being arbitrarily kicked out. Medicaid work requirements primarily target able-bodied adults who choose not to work. Again, able-bodied adults who choose not to work. They don't kick out caregivers, students, or people with chronic illnesses or disabilities. Again, no caregivers, no students, or people with chronic illnesses or disabilities. Because I remember that one of the news agencies said, well, they could be, they are not. Most coverage losses are projected to come from eligible workers who cannot navigate the complex paperwork and reporting portals rather than from those who are truly unemployed. All right, so that's a fact. Confusion over Medicare premium increases. The 2026 Part B premium increase is entirely due to a new federal policy or unprecedented spending. Now, this is where the Inflation Act comes in there. While the standard premium is rising to $202.90, much of this increase is tied to standard inflationary adjustments and historical utilization trends. Again, not targeting from the big beautiful bill to arbitrarily just raise it. It's based on inflation. Additionally, the 2.8 Social Security COLA for 2026 will more than cover the premium increase for the vast majority of retirees, though it will consume about a third of that raise. That's the fact. All right. Fraud alerts and scams, misleading information. Criminal groups are currently using the confusion around the new changes to target seniors through fraudulent health care claims warning. The U.S. Treasury Department has issued advisories about international groups registering fake providers to submit fraudulent Medicare, Medicaid claims using stolen beneficiary information. Be wary of unsolicited calls asking to update your information for the new 2026 rules. Now, I started with this because I am the only person who is telling you this. Now, here is what's been going on. The changes. I printed it out I copied it. So, key changes for the 2026 changes to Medicare. Significant cost increases, new federal requirements for Medicaid, and restricted eligibility for non-citizens. That's not altogether true. I just stated what the truth actually is, and be wary of the sound bites from the mainstream media. Sorry. So then they talk about the higher premiums and deductible. It is true, but they don't explain that there was a cost of living increase. Inpatient deductibles is increasing. So, and then they talk about prescription drugs out of pocket. That's not true either. So they say that annual out of pocket spending limit for Part D drugs is set at $2,100 for 2026. So this is taken out of context because the president made additional changes to that. And as president of the United States, they can do that. Now, I could keep going through this, but I don't want to lose my audience. Okay, so let's look at what was said about immigration restriction. One of the most significant shifts is a narrowing of eligibility based on immigration status. Okay, as I told you earlier, the way that this is worded, You need more information to see exactly who they were talking about, and I identified who was actually affected. Impact on protected groups. As I stated before, this is the same rhetoric of not putting more details to let you know. It does not include students. It doesn't include people with disabilities. It does not. Disenrollment. Individuals currently on Medicare who do not meet the new citizenship residency criteria are scheduled to be removed. That's partially not true. They have identified the people that they are talking about. So this is the flavor of what is written and what is talked about by the mainstream media. My complaint is that the people behind the scenes at these mainstream media outlets are picking and choosing the sound bites that they want you to know. What they really need to do is, and I don't blame the anchors, because if they don't say exactly what the writers and producers are telling them, they won't be employed. We need accurate information so that we can make good decisions, or informed decisions is a better way to convey it. And this is a prime example. And what caught my attention is there's been more sound bites lately about people losing their Medicaid that's been reported by the mainstream media, that's misleading you to what is actually happening. This is Just Listen, hosted by George Goodman. Let me know what you think and have a great day.